Joining me now to discuss it further, Admiral Brett Giroir, former HHS Assistant Secretary for Health and former White House COVID-19 testing czar under President Trump. Sir, I think Edward really laid it out very well. They're telling us from the White House that we shouldn't panic, yet they're doing all of these things to try to combat the spread of Omicron, yet we have no evidence that it's particularly worse or more harmful than Delta or the original coronavirus itself. Your thoughts?
Well, there's a lot more that we need to know. The reasons we are concerned is because the large number of mutations at many sites in the virus that are very concerning. And we know that it is rapidly taking over as the dominant variant in South Africa. But you are right. Everything we should be doing for Omicron, we should be doing for Delta as well. The things your listeners and viewers should remember is, number one, please get vaccinated. If you've not been vaccinated, even that first dose of vaccine will provide you a large degree of protection. Get boosted, because that boost really raises your level. These are very, very important things for you to do, and you have that in your control. Other things that we have in our arsenal, remember, we now soon will have an oral antiviral medication from Merck and Ridgeback that's pending authorization. That will work against all the variants. I do have some issues with the Biden plan, and I know you'll ask me about that, but don't panic, but be concerned. We do need to be concerned about this variant. But we can prepare for it, and as your lead-in said, we have so many more tools right now. Don't be afraid, just be prepared.
Let me ask you this question before we get to President Biden and some of the things that he outlined today. Many people will be coming on their year anniversary of getting the initial COVID-19 vaccine. What's going to happen in a month or so when people start to get to that point? Is a booster going to suffice, or at some point do you think the CDC is going to say you have to go back and get revaccinated, 2 shots all over again? I'm curious about that, because the time is, the countdown clock is on.
So obviously it's very difficult to predict the future, but let me just say one thing. There are very few vaccines that we have right now, not talking about COVID, that work if you just give it in a short period of time. You know this, you get vaccines over 6 months, a year, 18 months. So that 6-month wait really provides, it's not like an extra 1 shot, it's really a super shot to get your immune system going. So we are all hopeful that that will be sufficient. Now, that being said, this mutated virus is likely going to be less responsive to vaccines. I think we all expect that. And I want us to have our expectation that a successful vaccine, if I get sick for 2 days, not very ill, I'm returning to normal, have no long-term side effects, that's a successful vaccine. Let's not say vaccines don't work just if you get the sniffles for 2 days. That's a success. And we're going to see a lot more people with Omicron getting very mild disease. You don't have a force field around you,
right,
but you're not going to get hospitalized and you're not going to die, and that is a success.
And frankly, that's what was communicated from the beginning. We were told that these vaccines are not 100% effective from blocking the virus, that we could have breakthrough cases, but as you say, we wouldn't end up in the hospital, and that was the advantage or the incentive there. Let me just ask you this, back to the Biden policies. Obviously, we've got the travel ban from 8 African countries. We're talking about changing the COVID testing requirements, that 24-hour time period, and for people who are Americans, also for people who have been vaccinated, making that a little bit more strict. He also talked about testing today, saying that we need to make at-home testing kits more available, that he wants to make sure that private insurance companies are picking up the cost of that. With all these tools at our disposal, shouldn't we be a little calmer about this?
Well, we should be calmer about it, but I think the Biden administration continues to underperform. Just making it free from insurance is not good enough. Look, send home tests to everyone in this country, or at least everyone at risk. We know who is on Medicare. We know who's on Medicaid. We know who's at high risk. Send them in the mail. Don't send them a letter saying, go get tested. Send them the test. They lost 7 months of momentum when we had shortages of tests in September. They're trying to gain that back, but that's a simple thing to do that they haven't done. We need to stress also about the oral antiviral medications. Yes. These are really very effective that we might have them. And the third thing, I heard nothing in the plan about testing antibodies. Antibody therapies are very important, but we suspect that at least some of them are going to be ineffective against Omicron. We need to have another Operation Warp Speed to test antibodies in the pipeline that are going to be effective against Omicron. None of this was really said. All I heard was a lot of repeats of what we started in the Trump administration in half effort. So we do need to do more. He does need to do more, much more aggressive against this.
That's a great.
That doesn't mean lockdowns. Or anything like that. That means more aggressive about the kinds of things that we know work and can support keeping America open.
You are right about the antibody treatments. That is an excellent point. Admiral Giroir, thank you so much for your time tonight. Good to see you.
Thank you.